policy or I may not. So this is their strategic need and not their felt need. So it's very difficult to convince them, and we face these challenges from day one. How we have overcome is a question. If we can go to the next one, there is still one more I can go do that. Yeah. So with a show of hands, we pass everything in the AGM. In Annapurna Pariwar, we don't take major decisions in the board meetings, but we take in the annual general meeting, where in Pune and Mumbai we organize twice a year, and we have 10,000 women at least present. So after first 5 years of micro insurance, I took this very risky decision of connecting it with loan program. So everyone by a show of hand agreed that if we take a loan, we will get connected to the health insurance and we will buy this product. So this is how we overcome the challenge. So I think rest is we can do Q&A.
Invite some questions.
Well, let me first of all thank you very much, because this subject is absolutely new to me. I had heard about the microfinancing and community-based financing, but community-based insurance is absolutely new for me. And of course, given the fact...
Introduce yourself and your organization so that gives us context.
I'm Braj Kishore Dwivedi from Empower project, which is an EFART funded project in Jodhpur. So given the fact that there is a spate of blood-sucking insurance companies, you are a ray of hope, because this is really a program of the women, for the women and by the women, as you have explained you both. It's wonderful. What I'm surprised to understand is that why in our own project area, we could not come to know about this kind of program. Otherwise, the premium that you would have cited, just 130 rupees per annum. Even from our project itself, we could have insured not less than 25,000-30,000 women, because we are providing treasury reduction items worth 2,000 rupees per head. Then that was a very petty sum for us. We could have given this kind of good in our project.
The question is whether they are open to getting premium from outside their member base. Is that your question?
My question is that this kind of scheme is not popular elsewhere. I don't know what is that, because the second thing, can the self-help groups that we have involved in our project, can they also avail the benefits of this project?
Both I think is interconnected, so would you like to take that first and then after? Or we can take the other
Okay.
My name is Shoibal. I work with Saran, and my question is to Mirai. Basically, you are working with this insurance agencies and also mutual. So means when we talk with our member, I represent the association for the microfinance sector. Mirai knows it very well. So all of our these members, the only thing we get to know from them that there is a problem in claim settlement. So what's your response on this one? How to dilute this problem, because it is actually eating up the space. And to Medha, my question is like, when I was seeing your product, it was like 18,000 to 20,000. Your product is like that one, right?
Benefit.
Yeah, benefit. So is it adequate, or how do they cope up with these huge medical things?
Any other questions? I think we'll take just one more question.
Any other women? Any other women? Let's see some women's empowerment.
Yeah. I will start off with asking Mirai to answer the first question.
Sure. So the friend from Empower, I think perhaps the reason that you hadn't heard or it hadn't occurred is that savings and credit is a very different type of business. Our experience, even running savings and credit, is that insurance is very different. It's a much tougher sell. You have to sell insurance. It doesn't come naturally to people. It's not lucrative. Maybe, Annapurna's experience is a bit different, but we are an intermediary. We work with insurance companies, and the margins that the companies give us are very slim and shrinking. So it's not a lucrative business in the low-income segment. And it also requires a lot of patience and persistence. It's very conceptually different. So I think for those of us also who are in the microfinance sector, it takes us a while to understand. So maybe that's one reason. But having said that, we do have about 20, 25 partners all over the country. Many of them are microfinance institutions. And of course they are most keen to secure their portfolio for life, which is fine. But that is a beginning, and then one can go on to other things like health. In fact, my advice would always be start with life insurance if you've not done it before, to cut your teeth, and simple products like the wage loss product I suggested, and then slowly graduate to health insurance, which is most needed, most popular, but most difficult cup of tea to handle. Mutual may be different, but when you're working with companies. And then just quickly, since the claims issue came up, you're right, it's very difficult to deal with insurance companies. That's why we're going ahead and converting ourselves into an insurer, hopefully, if we can gather the 100 crores. But you have to keep working with the insurance companies. And I have to say, in all honesty, there has been improvement over time. The 3-month delays, now within a month, all the life insurance claims within a month. The health insurance claims take a little while longer, but still within 2 months. So we sit a bit on their heads, and they do process the claims as quickly as they can, but it takes time.
One question to you, like this when we are doing this one, what has happened that you are also mutual. In your case, how does it operate? How do you operate? Taking the concept from this community, or how does it work?
No, so as I said, we developed this income loss or wage loss product when RSBY came along, because we thought that health insurance to some extent was taken care of by RSBY, however it works. I mean, there were many people who got benefits. So then how could we, help our insured members more? That's when we came up with this mutual product, which is for hospitalization. As I said, it's an add-on to RSBY. The way it works is, if the woman, her spouse, or any of her children are hospitalized for more than, at least 24 hours, it's not for outpatient, then they get flat 200 rupees per day, up to 15 days, and we carry that risk. And vis-a-vis claim settlement, it's a very simple product. They just need to show that they have bought this Saral Suraksha Yojana, matlab their receipt, and secondly their discharge, a piece of paper from the hospital. Bus, that's all, only 2 pieces of paper. And they phone us on a helpline, toll-free, and register the claim, and we guarantee that within 10 days they get their money.
You're obviously very good jobs.
Yeah, like what Mirai Ben said, with life insurance, it's great to cut your teeth with life insurance, because if you die only once. Whereas in health insurance, I mean, every second month somebody in the family can get ill, and it's so cumbersome to go through the claims process, or even to get into hospital for this thing. So that is very, very important. Medha, if you want.
Yeah, I would like to, because his last part of you're from Sagar line. Yeah. So I take yours first. You asked me whether 18 to 20,000 is sufficient, and I say it's very much sufficient. Even after 15 years, our average cost of sickness has not crossed 4,500, because most poor people, they live in slums, they live in very cluttered areas, they fall sick with TB or they fall sick with jaundice, typhoid, waterborne diseases, and that doesn't cost much. So 20,000 a claim a year, that's the ratio. So I think I agree with Meera, you have to burn your hands with life insurance first and health. Health insurance is a very complex product. I also have a question here given by the organizers before. What is our advice to the MFIs? So I just take that and club it with the Empower friend. I think if you are a middle-sized MFI, it's better to take club microfinance and micro insurance. I know what I am saying. CRISIL has rated